Good morning to all. Today we have come here to flag off the orthodontic awareness day. So in this rally, here I will not tell tire with us. Guest of honor, Dr. Sri Krishna Chalasan, Honorary President, Indian Orthodontic Society, and Dr. Sri Devi Padma Naban, Honorary Secretary, Indian Orthodontic Society, Dr. Ujjyanta Yadav, and here we have Dr. Opandev, Honorary Vice President, Indian Dental Association, Tripura State Branch, and Dr. Sajal Nath, Honorary Secretary, IDA Tripura State Branch, and all my colleagues, my home, and all the reporters over here. First of all, I thank Indian Dental Association, Tripura State Branch, that they have invited me to my home again to celebrate this orthodontic awareness day. I'm very glad that people from outside, they have come here from a long distance. I will thank them that they have come here all the way to Agartala. Actually, you know, this dental surgery, there are so many branches, and out of this, there is one branch that is called orthodontic or orthodontic discipline. What is orthodontic? If there is, ortho means straightening. If there is abnormality in the alignment of the teeth, so in this discipline people or the specialist in this branch, they make it straight. So always they make it straight. If it is not in the track, they bring it into the track. So for that only, for this awareness among the people of Tripura, they have come here, and for that I appreciate the effort by the IDA Tripura State Branch and Orthodontic Society. Previously we did not have any orthodontist in Tripura. I brought one orthodontist from Guwahati. He started this treatment here, and after that now we had about 2 or 3 orthodontists in Tripura in this particular branch. So now they are doing very good job. Now the treatment endeavor is also changed. New invention has come into the scene. So they are providing service to the people, and we are very happy. Previously, what happened before I bring the doctor from Guwahati, they used to go to outside. Along with them, the guardians also used to go. What happened at the early age, it has to be treated. The best age is between 9 to 12 years, like that. So they are these patients are child. So along with the child, the guardians also ought to go. So naturally, huge amount of money had to spend. So in that case, now our these orthodontists are available here. They can treat, and people need not go to outside. So gradually in dentistry, all sort of disciplines, people, specialists are coming. So in future, I am sure that is because I am health minister also, I'm looking after this department. So in future, of course, there is question always from your side. My colleagues who is having this camera in front of me, they used to tell me when our dental college will be going to start it. So that I am addressing, and I'm sure that in future we will make it and we'll set up. I always again congratulate all the efforts being done by the IDA and Orthodontic Society, and I'm thankful to IDA State Branch that they have invited. Thank you very much.